When you have diabetes, taking care of wounds becomes much more difficult, especially if you can't feel them and don't know they are there.
In tonight's Real Men Wear Gowns, Eyewitness News reporter Jeremy Baker introduces us to one man who's been dealing with type 2 diabetes for close to 2 decades. And he talks about how the disease has affected his body's ability to heal.
I have this, how do you call it, Superman, nothing's gonna harm me, but it does, and it kicked my butt pretty good.
49-year-old Carlos Garcia found out he had type 2 diabetes 20 years ago.
At that time, it was just medication, no insulin or anything. That I wasn't that bad, so I was able to control it then.
For the past 10 years, he's been on insulin to control his blood sugar.
But if you don't follow the diet or follow your doctor's instructions, it doesn't help.
The medical director of the Wound Care Center at the Texas Diabetes Institute, Dr. Gina Gray, said he had to start coming to the center in 2015.
The big wound started as a very bad infection in his low back. And again, it's simple. As he said, it was a pimple.
The doctors had told me when I went into emergency, if I hadn't gotten there when I did, it was getting pretty close to almost gangrene type of wound.
When I was examining his wound, it was deep enough for me to put my hand in up to the wrist.
Thanks to the Wound Care Center, he's on the mend with that wound and a few others.
It's gotten to where you could barely get your little pinky in there, but it's still there.
The diabetes forced him to change his diet, but also his outlook on life.
This whole journey that I've gone through these past 2 years has opened my eyes a lot bigger than, they should have been opened back then.
Jeremy Baker, KENS 5, Eyewitness News.